When I started looking at the cancer story, I started thinking about the infection story too. We have the potential, according to various scientists, for over 10,000 oxidative mutagenic events per cell per day. Now that's even greater than the number of bacteria there. So we should be just eaten up with cancer all the time, but again, we're not. And the question is, why not? It's because our body, again, holds this in abeyance. We have the potential for any of these things to occur in an instant. A catastrophic infection with either a bacteria, a fungus, a virus, or perhaps even one of the plasmodium, the parasitic viruses such as malaria. If we get in an immune-suppressed state, and some of us are familiar with that because of AIDS patients who have an immunosuppressed state, they're not only susceptible to a wide variety of infections, but they're susceptible to cancer, Kaposi sarcoma. Why is that? Their body can no longer hold these things in abeyance. It's because that innate, continually operative oxidative system is diminished. It's in an insufficiency state. In 1954, a gentleman by the name of Dr. Denham Harmon, he came up with the free radical theory, and now it's known mostly as the free radical theory of aging. But what happened after he came up with this theory? And the theory basically said that free radicals are bad, especially of oxygen. And what that did was it had oxygen assigned as the causative agent in its free radicals to over 100 different diseases, pathophysiologies we call them. Now up to 200. And it was really guilt by association, merely because oxygen's in every aerobic cell in our body. But it was easy to make it seem like, well, it must be guilty, it's there. That's not the case. In fact, from this study that I have done, been able to show how important and how protective these oxygen-free radicals are. And the way to do that is to go back and see if there were genetic problems that some people are born with, these polymorphisms we call them, where they can't generate enough of these oxygen-free radicals. And sure enough, there's a disease called chronic granulomatous disease. And here we lack one of the enzymes that forms these free radicals. It's called a superoxide anion. These patients are prone to repeated infections. They usually die early age from infections, and they're prone to cancer. The very system that we use to protect ourselves was down. Now remember, I'm talking about, and I am pushing the idea of pro-oxidation. And the reason for that is when we look at the opposite side, what happens if we want to bring in pro-oxidants, things that makes more oxidation occur? Many of the chemotherapeutic agents are pro-oxidants. Irradiation itself generates pro-oxidants. That's how they work. If you take oxygen and put it in low levels in a patient receiving chemo or radiation, they won't work. They have to generate these products of oxygen to work. And there's another process called photodynamic therapy, which you probably haven't heard of, but this is popular in Europe. It's been around a long time, but it's, again, things progress very, very slowly in medicine. And photodynamic therapy is where you give a patient a photosensitive drug. And if you shine a certain light on it, a laser light, 630 nanometers, it excites that chemical. And when that chemical bumps into oxygen, it passes its energy to oxygen, and now oxygen becomes excited singlet molecular oxygen. What's the significance of that? Singlet oxygen kills cancer cells and does not kill normal cells. It's selective. Again, totally different than what happens with chemotherapy or irradiation, which has no specificity. It generates what it does, and unfortunately, sometimes the side effects of chemo and irradiation are just about as bad as the primary disease. So here are instances in which if you don't have enough of these oxidative products or the process occurring, you get into trouble, both with infections and with cancer. See, our cells do not have a means inside of them, some mechanical means, to kill a bacteria, a fungus, a virus. It has to do it chemically. And how does it do it chemically? Oxidatively. Just like we clean up our environment, oxidatively. On the other hand, if we supply a lot of these pro-oxidant compounds to individuals with cancer utilizing chemotherapy, etc., and PDT, this photodynamic therapy. The photodynamic therapy will kill all cell types of cancer we've found now. Pancreatic, breast, ovarian, it doesn't matter. Brain, hepatic, all of them. That's incredible in and of itself. But the fact that these are products that the body normally generates, so it is non-toxic to normal cells, has great potential to it. This is the first instance where we have of having selectivity in terms of killing the cancer cell without killing the normal cell. The usual approach for chemotherapy and irradiation is that we're going to try to kill the cancer cell, and we pray to God that we only half kill the patient. Unfortunately, that's the reality of it. But we can do better, a lot better. But it's going to require research work and such to prove these things of which I'm saying. Now, I was able to get the company that manufactured the catheter that I invented to put up $75,000, and we did a study at Tufts Medical School on a simple system that I've devised to generate excited singlet oxygen. I was at a meeting in 1992 in Santa Barbara on photodynamic therapy of the greats of the world there. And they were talking about photodynamic therapy and the use of the lasers and these photosensitive compounds. And you have to be careful with some of the photosensitive compounds, because if you go out in sunlight or such for the first 2 weeks, you'll react to it. It's absorbing that light energy. Well, as I'm sitting there, I say, wow, from my studies at Tulane, I said, I know how to generate singlet oxygen with compounds that are in every aerobic cell in our body in steady state levels all the time. I don't need the photosensitive compound. I don't need the laser. So when I first brought this to Tufts Medical School, I mean, it was nearly laughed at, which is okay, because at the end of that study, the results were so impressive that the man we hired to do it wanted to steal credit for the idea of doing it. And he wouldn't have known singlet oxygen if he tripped over it in the street. So even in science and medicine, one has to be careful of integrity, intellectual integrity. The desire to be first in something is also a very motivating factor, just as is the profit motive, which I had indicated before. Now, we had mentioned these antioxidant vitamins. As I'm telling you, the primary process that we have to protect ourselves is pro-oxidation. Then why in God's green earth would you take an antioxidant? Think about that for just a minute. Because that's what we've been doing. That's what I did for years. Took them by hands full. Said, this is what everybody said was good. Must be good. No. The little handout that we passed out there shows you just a few of the studies that I've summarized for you that tells you what the literature says about the antioxidant vitamins. Because of Dr. Harman's theory, his free radical theory, oxygen and its free radicals got demonized. I mean, these were the worst little chemicals you could think of. They were called the great white sharks of the blood system and the cytoplasm. They've been called everything you can think of bad, but they're not. They're our greatest ally. Now, Dr. Harman is a very gracious old gentleman. He's about 90 years old now. And he and I are friends. In fact, 2 years ago in Denmark, I followed his keynote address. And he's the founder of this particular society. And I outlined to that group very quickly that I feel that this whole free radical theory is a terrible myth. It's misled us. It's put us on the wrong track. But at least Dr. Harman and I agree his theory was adequate to stimulate someone like myself to look into it more carefully. And here's what we've come up with. You see, because of these free radicals, they're supposed to cause cancer, heart disease, strokes. Not only, then if you gave an antioxidant, you would protect yourself from these problems. You might reverse it. It doesn't happen. What happens when you see the large randomized clinical controlled trials that have been done? Not only do they not block cancer, heart disease, and stroke, they increase the incidence of cancer, heart disease, and stroke, and they increase the incidence of overall mortality. You not only increase your risk to get these diseases, but you increase your risk of dying. That's what it says. And now I have reviewed the studies on over or approaching 1 million people. And this is real important because frequently in the labs we will see studies on lower species in the phylogenetic scale, mice, rats, rabbits, dogs, etc. But they're not people. Sometimes that data does not extrapolate to man. So when I can find studies in people, and you and I, that's the ones I really want to pay attention to. And now we have a huge amount of data collected and available. One of the problems we run into is that most of these symposia that I talk about, they're also out in the exhibit hall, people selling the antioxidant vitamins. There are lots of them. Sometimes they sponsor the whole symposium. So they're not very much in favor of hearing me talk at some of these. But it's not an opinion that I'm giving them. I'm giving them a reflection of the facts. That's difficult to refute. And they'll pull some non-randomized small studies and say, well, look, it did good in this study. Say, no, we're talking about nearly 1 million people now. That's very difficult to finagle the results with. And that's something else you have to watch in medicine and science, is statistics. You might have heard of the old saying that there are 3 types of liars: white liars, damn liars, and statisticians. And they're the worst of all because they can really alter the data incredibly. We could probably find some data that people wearing blue shirts driving Fords have a greater incidence of getting cancer, and someone would come out with a paper saying Ford and blue shirts causes cancer. No, it doesn't. That's the kinds of things that are out there that we have to deal with every day. Now, look at this top study, the alpha tocopherol, the ATVC study. And you see that this was done on 29,000 male cigarette smokers, 50% increase in hemorrhagic stroke and deaths among the vitamin E group, 11% increase in ischemic heart disease deaths among the beta-carotene group, and 18% increase in lung cancer among the beta-carotene group. It was stopped 21 months early because the physicians running the study felt it was unethical to go forward with it any further. That must tell you something. It stood out that clear. If you're taking this stuff, you've increased the risk of all of this, plus to increase the risk of dying.